Good morning, distinguished representatives, ladies and gentlemen. I have the great pleasure in declaring the 75th session of the World Health Organization Regional Committee for the Western Pacific open. I will now deliver my opening address. Honourable Ministers, distinguished representatives, Dr. Saia Piukala, Regional Director, Dr. Ailan Lai, Assistant Director General, representatives of agencies of the United Nations, intergovernmental organizations and non-governmental organizations, distinguished colleagues, ladies and gentlemen. It is my great pleasure and honor to welcome all of you to Manila and the 75th session of WHO Regional Committee for the Western Pacific. I'd like to begin by thanking Member States, the WHO Secretariat, and our partners for their hard work and achievements over the past year and the thorough preparations for this regional committee. This is a special year, as it is the first regional committee meeting with the new regional director, Dr. Saia Piukala, at the helm. Dr. Piukala, congratulations once again, and we look forward to continuing to work with you this week and beyond. I would now like to report on you on some of the progress that has been achieved since we last met. This time last year, the regional committee endorsed and to facilitate implementation of the international health regulations, including recent amendments. APSAF is part of health security fabric in our region. Another technical agenda items we deliberated and endorsed last year was the new regional framework to shape a health workforce for the future of the Western Pacific, which set out directions to optimize and strengthen the health workforce to fit the rapidly changing health needs of the populations. In September 2024, parliamentarians from across the Asia-Pacific came together in Vanuatu to reconfirm their commitment to support and strengthen the health workforce. And Member States' focal points will meet in November in Laos People's Democratic Republic to share lessons to implement the strategic actions envisioned in the new framework. Another key technical agenda items we discussed last year was health innovation. The Western Pacific continues to lead the way in embracing innovations and transformation, making it a model for the world. I was pleased to see the endorsement of the Regional Health Innovation Strategy for the Western Pacific, which aligns with WHO 13th General Program of Work 2019-2025, priority to harness innovations for accelerated health impact. This strategy will serve as a foundation for governments to leverage health innovations, solve pressing challenges, and shape the future of population health and well-being. Last year, the Regional Committee also endorsed the Regional Action Framework on Communication for Health, a vision for using communication to improve public health in the Western Pacific, or C4H. In collaboration with key stakeholders and partners, WHO in the Western Pacific has continued to strengthen skills in core areas of the C4H, including the use of behavioral insights. C4H has been applied in WHO's work across the region, from addressing NCD risk factors such as tobacco control and suicide prevention to outbreaks of dengue and avian influenza. And practical tools have been developed to support member states and partners in the application of CPOH principles in health innovations. Last year, we also had an important discussions on rethinking health financing for social well-being and sustainable development. It highlighted the need to renew our efforts in financing universal health coverage and to recognize the intricate links between health, well-being, and sustainable development. As recommended at last year's meeting, WHO has, in consultation with member states, developed a draft regional action framework for health financing to achieve universal health coverage and sustainable development in the Western Pacific. The framework, which will be considered for endorsement at this meeting, takes stock of the latest health financing developments in the region and proposes a set of strategic actions to guide member states when designing and implementing health financing policy. Distinguished representatives, thank you again for entrusting me as the chair of the 74th Regional Committee meeting. I'm grateful for last year's office bearers for their support, and I'm thankful for the WHO Secretary for all the efforts to support member states over the past years and the preparations for this 75th Regional Committee meeting. Thank you very much. And now I have the pleasure to introduce our very own WPRO Music Company. Please let us welcome them. Wow, this was wonderful. Thank you very much, WPRO Music Company. How lucky we are to have such a talent in the Secretariat. So if any of you need them, so you know who the agents are. So, well, thank you very much again, WPRO Music Company. We now proceed with the election of the new officers, beginning with the chairperson. Are there any nominations for the office of the chairperson?
Mr. Chair.
Okay.
Yeah,
We call on Malaysia to speak.
thank you. I nominate Cook Islands to be elected for the post of the chairperson.
Thank you.
Thank you.
Are there any seconders? I call upon Australia.
Apologies. Thank you, Chair. Australia second their motion nominating Cook Islands to be the chairperson.
Thank you. The representative of Australia has seconded the representative of the Cook Islands for the office of chairperson. Are there any other nominations? If there are none, I have the great pleasure in pronouncing the representative of Cook Islands, the Honourable Vainitutai Rose Toki Brown, Minister of Health, as chairperson. Will the Honourable Minister Toki Brown please take the chair? I thank again the other officers of the last sessions and wish the new chair the very best of this meeting.
Warm greetings, everybody. Good morning to each and every one of us. I thank you all, honourable ministers, distinguished representatives. I thank you all for electing me as chairperson of the 75th session of the Regional Committee for the Western Pacific. I would like to ask your indulgence in allowing me to postpone my address to the committee until tomorrow morning. We now proceed with the election of our Vice Chairperson. Distinguished representatives, are there any nominations for the office of Vice Chairperson? Marshall Islands. Thank you.
Madam Chair, I nominate Vietnam to be elected for the post of Vice Chairperson.
I thank you. The representative of Marshall Islands has nominated the representative of Vietnam for the office of Vice Chairperson. Are there any seconders?
Madam Chair, I second the motion nominating Vietnam to be elected for the post of Vice Chairperson. Thank you.
I thank you, representative of Fiji. You have now seconded the nomination of representative of Vietnam for the office of Vice Chairperson. Do we have any other nominations? There being none, I have much pleasure in pronouncing the Vice Minister of Health of Vietnam as our Vice Chairperson. Honourable delegates, as for the election of the rapporteurs, we'll have to come back at a later stage. So I thank you very much and congratulations to our Vice Chair, and I look forward to working with you and ensure that we have a smooth and efficient meeting this week. With that, we will now move to our next item. Item number 5, adoption of the agenda. Distinguished representatives, document WPR/RC75/1, reference 1, contains the professional agenda. And as you may recall, in the last session of the Regional Committee decision WPR/RC74/3 on allocation of executive board seats, it was decided to request the regional director to prepare options for the equitable distribution of EB seats allocated to the Western Pacific region. And to implement that mandate, following consultations with member states in the region, the proposal of the regional director to establish an informal working group of member states representatives on the executive board seats allocation was accepted favorably by member states. May I now call the Honourable Dato Dr. Mohammad, Jaafar, Minister of Brunei and Chair of the Informal Working Group, to give us an update. Minister for Brunei. Thank you.
Thank you, Chair. Honourable representatives, as you are aware, the Republic of Indonesia has written to the Director General to request to be reassigned from WHO's Southeast Asia region to the Western Pacific. In light of this, as Chairperson of the 74th session of the Regional Committee, I propose that the informal working group on Executive Board seat allocation be postponed until the Indonesia issue is finalized. In the interim, I propose that the Regional Committee proceed with a private and informal meeting, or caucus, be held during the 75th session to discuss Executive Board seats. The Secretariat communicated this in a note verbal to Member States on 13 September 2024. As such, the issue of a new formula for the allocation of WIPRO's Executive Board seats will not be discussed at this session. Thank you.
Thank you, Minister. As also decided during last year's session of the Regional Committee, WPR/RC74/1 on governance reform item 3 notes that members of the Western Pacific region shall meet in private during the session of the Regional Committee to discuss proposals for the elective post, with the agreed proposals then announced at a public meeting. As such, the caucus will meet this Wednesday evening, and the results shared with the Regional Committee on Thursday. I now open the floor if there are any comments. In the absence of no comments, the agenda is now adopted. I'm sorry. Minister from Samoa.
Thank you, Mr. Chairman, Madam Chair. And I congratulate your Honourable for being a Madam Chair for this meeting, and also the Vice Chairman. Greetings and talofa from Samoa. I, on behalf of Samoa government, we show our sincere appreciation to the Regional Director and the Western Pacific Region Office for hosting this year's meeting. On that promises to be another successful meeting of WHO Regional Committee for the Western Pacific region. My delegation, I would also like to extremely thank the government and the people of Philippines for the warm hospitality accorded to us since our arrival. We would also like to extend our deepest gratitude to the management and the staff of the WHO Western Pacific Region Office for the excellent arrangements made for this meeting. We are pleased to be here in person to attend this very important meeting that provides collective voice of the Western Pacific region. We wish everyone an enjoyable and successful meeting. Allow me by thanking the outgoing chair on behalf of Samoa government for its important work he had done over the course of last year. We pray God's blessings to be upon you abundantly. To conclude, Samoa supports the agenda proposed by the regional office for this 75 regional committee meeting. Soifua, Faftai.
Thank you very much, Honourable Minister from Samoa. Do we have any further comments? I see no further comments. Now the agenda is adopted. Before we move further with our agenda, I would like to draw your attention to a matter concerning observership at the current Regional Committee session. Under Rule number 2 of the Rules of Procedure, states which are not members of the committee may be invited to participate in its proceedings without the right to vote. Therefore, I would like to propose that Indonesia be invited to observe the session of the Regional Committee on the understanding that it will be able to attend all meetings and will be granted with the right to speak under item 15.5A. The item dealing with its request for reassignment from the Southeast Asia to the Western Pacific region. I will now open for any comments. If anyone wishes to speak on this item, and if no comments, and I see there are no objections, it is so decided. Now, I would like to invite the Secretariat to provide a short briefing on how we will organize our work this week. May I now call on Dr. Susan Mercado, Director of Program Management. Dr. Mercado, over to you. Thank you.
Thank you, Madam Chair and Honourable Ministers, Secretaries of Health and colleagues. I'll just walk you through the agenda that we have just adopted. So let's go to the next slide, please. Of the agenda. Then, after the break, we will have the address by and report of the regional director, including the presentation of the new vision. In the afternoon, we will have the address and report of the regional director continuing, including comments from our member states. And then we have a panel discussion on climate resilience in healthcare facilities. And we have our traditional dinner hosted by the regional director at 6 o'clock to 8 o'clock. And a little later, we will talk about the logistical arrangements. So in between all of these, there are some bilateral meetings and some groups that are meeting, but I'm not going to present that anymore, just to give everyone an idea of what the flow is for the work of the whole regional committee. Next slide, please. So on October 22, tomorrow, we have the address of the Director General, which will be done live. The address by the incoming chairperson. Oh, sorry, the Director General will be live but virtual. And then we have address by the incoming chairperson. And we will have the discussion on program budget 22-23 and from headquarters a presentation on program budget 26-27. We then have a panel discussion on transformative primary healthcare, and we have a very special event, the investment round, at 12:50 to 1:50. So delegates are requested to have lunch right away, and everyone is invited to the investment round. In the afternoon, we have the coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee, and some other items include membership in the region, request for Indonesia to be reassigned from WHO Southeast Asian region to the Western Pacific region. After that, we have a agenda item on health financing and two important side events, one on tobacco and a second one on the pandemic fund. Next slide, please. On the third day, we have coordination of the work of the World Health Assembly and the Executive Board and RC still continuing. Then we have the WHO's work in countries, which are short presentations from various delegations, panel discussion on oral health, and then we have another very interesting event, Health for Life Fund. In the afternoon, we have health financing continued as there may be additional interventions from the member states and a presentation for the Regional Action Plan on Digital Health. Our side event is on One Health at 4 o'clock, and 5:15 there will be a private informal consultation or a caucus of the member states. Next slide, please. On Thursday, we have progress reports on technical programs, and then we have coordination of the work of the World Health Assembly, Executive Board, and the Regional Committee again. So there are a number of items under that space of coordination. These include accreditation procedure for regional non-state actors not in official relations with WHO to attend meetings of the World Health Organization Regional Committee for the Western Pacific. And then we have a briefing session on the INB and the pandemic agreement. In the afternoon, we have coordination of the work of World Health Assembly, EB, and RC again, this time tackling WHO reforms and items recommended by the World Health Assembly and the executive board. We then have an informal consultation on the EB, the executive board decision 155 bracket 12 on process of handling and investigating potential allegations against the WHO Directors General. Next slide, please. And on Friday, we have the special program of research, development, and research training in human reproduction, membership of the Policy and Coordination Committee. Then we have a discussion on, again, the coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee agenda for the 76th session of the RC in 2025. We will then have the presentation of time and place for the next regional committee meeting, the next two regional committee meetings, and then we close the session. So next slide, please. So that whole schedule is in your calendar, it's in your pocket. There will be some adjustments if we need more time for discussions. Practical reminders, kindly limit your interventions to 300 words or 3 minutes. There's a timer on the screen. Press the big button on the microphone so you'll see it right in front of you with 2 little red triangles beside it. Send to the WPRC Ministerventions, is that correct? RCM interventions at WHOINT. And then for draft resolutions, these are available on the RC75 SharePoint portal tomorrow. Next slide, please. Okay, finally, last but not least, for the first time in history, we have a regional committee exhibit. You saw the big tent outside, and we will have a bit of a ceremony right after this. And we encourage you to spend more time at the exhibit to see the work of the region in technical programs, work with countries, etc. Thank you very much, everyone. Madam Chair, back to you.
Thank you very much, Dr. Suzanne Mercado. Honourable Ministers, we will now rewind back a little to complete the election of our office bearers. Now we go to election of rapporteurs. May I ask first for nominations for the office of rapporteur for the Chinese language? Representative of Tonga. Thank you.
Thank you, Madam Chairperson. Tonga wishes to nominate China to be elected for the post of rapporteur in the Chinese language.
Thank you, Minister from Tonga. The representative of Tonga has nominated the representative of China as Chinese rapporteur. Are there any seconders? I see Minister from Vanuatu.
Thank you, Madam Chair. I second the motion nominating China to be elected for the post of rapporteur in the Chinese language. Thank you.
Thank you very much, Honourable Minister. Now, the representative Minister of Vanuatu has seconded the nomination of the representative of China for the Chinese rapporteur. Are there any nominations? There being none, I have much pleasure in pronouncing Ms. Duan Bowei from China as Chinese rapporteur. May I now ask for nominations for the office of rapporteur for the English language? Papua New Guinea.
Thank you, Madam Chair. For the post of rapporteur in English language of this 75th session of the Regional Committee for Western Pacific, I nominate Philippines to be elected for the post of rapporteur in English language.
Thank you. The representative of Papua New Guinea has nominated representative of Philippines as English rapporteur. I look for a seconder. Lau.
Thank you, Madam Chair. I second the motion nominating Philippines to be elected for the post of rapporteur in the English language. Thank you, Madam.
Thank you, Honourable Minister. The representative of Laos People Democratic Republic has seconded the nomination of a representative of Philippines to be English rapporteur. Are there any other nominations? There being none, I have now much pleasure in pronouncing Dr. Kenneth, Undersecretary of the Department of Health from the Philippines, as our English rapporteur. Now, we move on. May I ask for a nomination for the office of rapporteur for the French language? I see FSM, the floor is yours.
Thank you, Honourable Chairperson. For the post of the rapporteur in French language, I nominate France. Thank you.
Thank you. Thank you, Honourable Minister. The Honourable Minister from Federated States of Micronesia has nominated a representative of France as French rapporteur. I seek for a seconder. Singapore.
Thank you, Madam Chairperson. I second the motion nominating France to be elected for the post of rapporteur in the French language.
Thank you. The representative of Singapore has seconded the nomination of a representative of France for French rapporteur. Are there any other nominations? There being none, I now have much pleasure in pronouncing Noémie Berthier from France as French rapporteur. Thank you very much, Honourable Ministers, and congratulations to all my fellow office bearers. I look forward to working with you all to ensure a very smooth and efficient meeting this week. So I am not alone. Thank you all. Honourable Ministers, before we open the floor, we ask all honourable delegates, I beg your pardon. There is one other matter, a very important issue that I would like to briefly mention as chair of this RCM. As you are all aware, WHO has a zero tolerance policy for any form of harassment and sexual misconduct at any WHO event or WHO premises. The organization is committed to enabling events at which everyone can participate in an inclusive, respectful, and safe environment. All participants are expected to behave with integrity and respect towards each other and everyone involved in this event. If a participant has a concern, please speak to Dr. Rodell Nodora, our Acting Prevention of Sexual Misconduct Management Officer, on this side. And also Dr. Wendy Snowdon, Country Liaison Officer of Kiribati, of the Organizing Committee. Thank you. Reports or complaints can also be made to the WHO Office of Internal Oversight Services at investigation@who.int. WHO also has a zero tolerance policy for inaction in these cases, so all concerned will be handled conscientiously and confidentially. Lastly, I would like to ask and to remind us all to please speak slowly and clearly into the microphone. This is very important for all our interpreters. Now, I open the floor. Oh, sorry. Thank you for understanding. Honourable Ministers, distinguished delegates, before we break for coffee, we need to take a group photo. This is the best part, I think. So the group photo will be taken inside here, our conference hall. After the group photo, may we request everyone to proceed to the lawn outside the conference hall for the opening of a special exhibition for the 75th Regional Committee meeting entitled Weaving Health for All. Then the second part, refreshments are already available at the exhibition area. The plenary session will reconvene in 20 minutes, 25 minutes. So please make your way back in on time and be on time, please, Honourable Ministers. And I now call on our Regional Communications Manager to provide the details of the group photo. Thank you.
Thank you so much, Chair. Hi, everybody. Welcome back. Welcome to those for whom this is the first time. As usual, we'll be doing 2 photographs. First with the Regional Director, the ADG, and all of our heads of delegation. So in a moment, we'll ask all of those people to move into the center of the room here. And while we're doing that first photo of the heads of delegation, we just ask all the other delegates and members of the Secretariat to just wait for a few moments in the adjoining room or in the foyer or in the hallway just outside here. And once we have that first photograph, we'll invite everybody to come back inside and join us for a second photo. You'll slot in behind the heads of delegation and we'll take a second picture with everyone. So if we can just ask everyone to, as efficiently as possible, if your heads of delegation move into the center already, and if you're anyone else, just move into the area outside of this room for a few minutes and be ready to come back in when we call you. Thanks so much. Thanks so much, everybody. I know it's a lot of movement, but if we can get
Hello again, everybody. We will be starting very shortly. So please make your way inside our conference room. Well, welcome back, Honourable Ministers and our distinguished delegates. I think now I would like to call everybody for a round of applause for our RD and all his hardworking team that has put a lot of effort into the exhibition that we have just witnessed today. Congratulations to your RD and your hardworking team. So we have seen past, present, and future health services and health centers. So amazing. I think you all agree with me. This is a great effort. So thank you very much again. Now we will move on to our item number 7, distinguished representatives. You should have before you documents WPR/RC 75/2 and RC 75/INF/2. The report of the regional director covers the work of WHO in the Western Pacific region during the period of 1st of July 2023 to 30th of June 2024. Regional Director Dr. Saia Piukala and the directors will together present the Regional Director's report. Then Dr. Piukala will present the draft vision. It is now my great pleasure to invite Dr. Piukala to make his first address to the committee together with WHO senior management in the region. The floor is yours, Dr. Piukala.
Madam Chair, Honourable Wainetutai Rose Toki Brown, Honourable Ministers, representatives from Member States and development partners, WHO Assistant Director General, Dr. Lee Island, ladies and gentlemen, Magandang umaga, and good morning to you all. It is with great joy and heartfelt warmth that I welcome you to the 75th session of the World Health Organization Regional Committee meeting for the Western Pacific. And I'm deeply grateful for your presence and your participation. And I would like to express our gratitude to the outgoing chair, Dr. Isham Jaafar, for your leadership and friendship. You have been an incredible support to our region, making a significant impact in serving our families and our communities. And I thank you, my brother. And my congratulations and sincere thanks to our incoming chairperson, the vice chairperson, our rapporteurs, for agreeing to serve in this important role. And I look forward to working with you this week. As you all know, this is my first regional committee meeting as regional director. And I'm excited and honored to be here with you today as the first regional director from the Pacific. The regional committee should be the platform that we utilize to work together to sharpen our focus on what really matters, and that is improving the health of the people of our region. In my first 9 months as regional director, I have visited 22 countries and areas and experienced firsthand our diversity and have witnessed our realities on the ground. I have noticed in all these travels that our region has a distinct flair on innovative public health. This is very much intertwined with our rich cultural heritage and tradition, and a very good reason to believe that our heritage is the greatest source of our strength as we confront the significant health threats of our time. I have been inspired by the amazing work of our frontline health workers across our region. No matter if they are in big cities, remote islands, or rural communities, they are all dedicatedly and selflessly helping our people. I have had the opportunity to listen to health ministers, most of whom are here with us today. Our senior leaders in health, those in foreign affairs and finance, as well as with partners and experts from various sectors. And I would like to extend my sincere gratitude to everyone who took the time to speak with me for your trust and your support. I also greatly enjoyed interacting with our WHO colleagues in our country offices. About 60% of the WHO workforce is based in our country offices, and I am very proud of all of them and the work that they do. Can we all put our hands and thank all the WHO staff? And I was particularly impressed by the passion, the commitment of our staff to serving you, our member states. And for those I have not yet met, I look forward to meeting you all soon. Experiencing firsthand the region's rich diversity has truly reaffirmed my core belief that public health revolves around the local context and local solutions. In our region, one size fits all simply does not work. However, there are several health challenges that are common across countries and areas in our region. We are all affected by climate crisis, breakdown of social fabric, vulnerability of our system for healthy foods, safe water, and reliable energy, as well as demographic aging and health inequities. And this is true across our region, from mega cities to remote atolls. But the essence of connection and shared experiences binds us all. We also share similar priorities, and they include achieving universal health coverage, ensuring preparedness and resilience for emergencies and climate crisis, and having inclusive systems for everyone in our communities, including members of the LGBTQI+ and persons with disabilities. Though at times we face immense challenges, the Western Pacific region remains relentless in our pursuit of better health and well-being for all. Every day, we've become stronger. We've become more wiser and more determined to make a difference. You will see this for yourself in the upcoming presentation of the report of the Regional Director, and I'm honored to share some of the highlights of the WHO work in the Western Pacific region from July 2023 to June 2024. This is a transitional report that captures our work, and initially under the guidance of Dr. Susanna Jakob, my biggest thanks to her, as well as what we have accomplished since I took office. We have been carrying out and implementing the previous vision for the future towards the healthiest and safest region. And I think it is important that we continue to build on its legacy. We all gained experience and learned about the vulnerability of our health systems during the COVID-19 pandemic. Building on the lessons that we've learned, we have refined our approach and crafted a post-pandemic vision for the work of WHO with member states and partners, which I will share in detail later. The first 100 days of my term were spent addressing serious organizational issues as requested by you, our member states. I was seriously concerned about the findings of a staff survey, which revealed that 1 in 5 members of our workforce reported having suffered harassment or psychological abuse. 1 in 2 reported experiencing discrimination, and only a third of our colleagues who faced bullying or abuse felt comfortable enough to report their experiences and seek help within WHO. I immediately launched the Healing Hearts Initiative with the Director of Program Management, using a framework of trauma-informed workplaces, and we are building workforce capacity for resilience and developing social support space, such as small groups for arts, music, and sports, amongst others. By January 2025, we anticipate concluding the Healing Hearts Initiative and putting in place a renewed workplace culture unit that will continue to carry out initiatives and monitor impact. I will continue to have an open door policy and hold monthly feedback sessions with our general service staff, who are the backbone of our work. Efforts to foster a culture of respect, trust, and solidarity are some of the best investment we can make. And that is what we all deserve. A happier and a healthier workforce can better support and serve you, our member states. In addition, we are reshaping work streams in the regional office, ensuring minimal disruption with a focus on sensible, cross-cutting solutions that are fit for integrated problem solving. We are putting the right people in the right places to achieve results in the countries we serve. Further, these changes are being carried out in line with the global organizational changes. In fact, the Western Pacific region is the only one of 6 regional offices to be fully aligned with WHO Global Transformation Agenda. We have also been leading the implementation of recommendations from the Action for Results Group. We were the first WHO region to sign the Enhanced Delegation of Authority. Now, WHO country offices in the Western Pacific are more empowered to respond effectively to our member states' request. This region is also leading the implementation of the core predictable country presence. We have already hired 74% of the recommended staffing, who are reinforcing the capacity of our country offices. In addition, we have taken swift action to put into practice the United Nations Disability Inclusion Strategy since its introduction last year. Several efforts have been revitalized to address the severe impacts of what is now commonly called the climate crisis. This crisis has disproportionately affected the people of the Western Pacific region. Efforts at the WHO Asia Pacific Center for Health and Environment have been intensified under the leadership of the Director of Program Management. In close coordination with partners, and there is work underway to elevate advocacy and action focusing on small island developing states, coastal communities, and more than 2,000 urban centers and cities across our region. Our technical directors will soon share highlights of the work we have been doing in collaboration with our country offices. The heads of our country offices are also here with us this week. And please, can we all put our hands together and thank them for the work that they are doing serving our member states. But first, I would like to highlight some of the achievements, starting with our congratulations for Cook Islands, which earlier this year prohibited the manufacture of tobacco products on their home soil. Can we put yes. China, which has imposed excise taxes on e-cigarettes. And allow People's Democratic Republic for becoming the fourth country in the region to introduce plain packaging for tobacco products. In October 2023, we also celebrated the elimination of lymphatic filariasis in the Lao PDR. And I recently visited an outstanding model for primary healthcare in the Philippines called Better Agent Care and Ambulatory Services, the Piukala Center. And I was greatly impressed with the innovation. Thank you, Minister. Cambodia, Lao PDR, Malaysia, Papua New Guinea, and most Pacific Island countries have just finished their new country cooperation strategy, which are crucial steps toward anchoring our work with long-term collaborative and evidence-based programming. And we also celebrate today another historic achievement with Vietnam's elimination of trachoma as a public health problem. Truly, the diversity and the resilience of the Western Pacific and the commitment of WHO workforce to serve our member states is inspiring. Every morning when I wake up, I find more reasons to be encouraged by the promise and potential of this region. As Helen Keller put it, alone we can do so little, but together we can do so much. Ladies and gentlemen, honorable ministers and representatives from our member states, I now turn to our directors to share the important work that they have been doing together with their teams to deliver on WHO commitments to you, our member states. Thank you.
Honourable Ministers, distinguished guests. During the time frame of this report, we have experienced numerous outbreaks, disasters, and climate change-related crises. WHO responded to the Zud in Mongolia, a dengue outbreak in Samoa, floods in the Philippines, Vietnam, and Lao People's Democratic Republic. 62 food safety incidents were reported in the past year through the International Food Safety Authorities Network, InfoSan. We are reminded yet again of the importance of collective action for the prevention, preparation, and response to emergencies. Last year, the Regional Committee endorsed the updated Bi-Regional Asia-Pacific Health Security Action Framework, APSAF. The framework guides our work, including implementation of the international health regulations and its recent amendments. Coordinating health security, as well as expanding and maintaining health security capacities at the regional level, were major priorities. WHO supported the expansion of GOAN, the Global Outbreak Alert and Response Network, with over 80 member institutions in the region. And the region-wide simulation exercise to practice and test IHR coordination and communications between national focal points and WHO focal points. We also continue to strengthen country-level capacities. Through the Field Epidemiology Fellowship Program, 11 fellows joined the division for up to 3 months each, continuing to strengthen regional epidemiological capacities and networks. The Emerging Molecular Pathogen Characterization Technologies Surveillance Network, EMPACT, has expanded laboratory capacities of countries to cover priority pathogens such as respiratory syncytial virus, dengue, and mpox to complement influenza and COVID. And we continue to expand emergency response capacities, such as our work in the WHO Emergencies Medical Team EMT initiative. As a result, the Western Pacific region now hosts 16 WHO-classified international EMTs that can respond to both regional and global emergencies. This is just a small sample of all the work we have been supporting, hand in hand with member states, through our WHO country offices, and with our partners. WHO will continue to build on the lessons and achievements from previous years to emphasize multisectoral coordination and action using a One Health lens in order to improve health security. Please join us this week in a number of side events focusing on the Pandemic Fund, One Health, and a briefing on the pandemic agreement negotiations. Visit the emergencies booth to learn more about APSAF, our emergency response preparations, and the different programs that support our collective action and efforts in health security. We welcome your feedback on this important journey together.
We now have with Dr. Hong Pan, the Director of the Division of Programs for Disease Control. They continue to advance the implementation of global and regional frameworks, including the regional framework for reaching the unreached, to reduce morbidity and mortality from communicable and non-communicable diseases.
Honourable Ministers, distinguished guests, over the past year, we have been working closely with WHO country offices and member states to strengthen our political commitment and policies to control and eliminate diseases persisting in our region. Tuberculosis treatment coverage in the region is now back to pre-pandemic level due to high-level political endorsement and support. We also support countries in conducting strategic surveys and epidemiological analysis for TB control, enabling us to tailor interventions. Many countries expanded HIV testing sites and integrated viral hepatitis services into the national health systems, enhancing service delivery and improving access to care for affected populations. Through local leadership and close interagency coordination, and with the support from WHO office in the region, the WHO Mekong malaria elimination programs have seen great success in significantly reducing cases and deaths due to malaria in Cambodia, the Laos, and Vietnam. We also remain committed to the elimination of neglected tropical diseases. WHO has supported mass drug administration in countries such as Papua New Guinea, Vanuatu, the Philippines, and Samoa, including to the substantial progress in eliminating lymphatic filariasis, schistosomiasis, and yaws. We also supported Vietnam in achieving trachoma elimination certification, making it the 5th country in the region to achieve this status since 2016. The achievement reminds us to continue the fight as these diseases continue afflicting the poorest and the most vulnerable populations. Distinguished delegates are invited to explore our exciting interactive exhibit featuring the Reaching the Unreached map tool. This tool showcased high-resolution data on health equity gaps and vulnerable population, demonstrating efforts in reaching the unreached communities in the region. We remain focused on high immunization coverage, introduction of new vaccines, and immunization through the life course. We emphasize the importance of robust surveillance system and integrated service delivery to reach zero-dose children and close immunity gaps. We also committed to support Pacific Island countries and areas to be verified for measles and rubella elimination in 2025. And in the urgent ongoing fight against non-communicable diseases, the Healthy Heart programs in the Philippines demonstrates the impact of integrated NCD services and highlights the importance of local government's leadership role in successful initiative. With the division's assistance, the Healthy Heart programs have focused on governance, supply chains, improvement, and community engagement. On mental health, much work has been done on suicide prevention through high-level advocacy and strategic communication through leadership in mental health campaigns and capacity building. To build on progress, our future efforts will focus on strengthening integrated service delivery, enhancing multi-sectoral actions, empowering communities, and leveraging innovations. In this way, we will promote transformative primary healthcare and ensure the sustainability and the efficiency of disease control programs in the region. Thank you very much.
Next, we will hear about the work of the Data Strategy and Innovation Group. The group champions the use of data, digital technology, science and innovation, as well as future-oriented lenses and methodologies to drive transformative actions towards universal health coverage. Please welcome the group's director, Dr. Dato.
Honourable Ministers, Excellencies, and distinguished guests. While the region has a wide range of the country context, the common thread is that data, strategy, and innovation are necessary to help us to overcome hurdles to achieve universal health coverage. First, I'd like to thank you all for your all endorsements of the Regional Health Innovation Strategy for the Western Pacific last year. Implementation has proceeded swiftly. We convened 40 representatives from public sector health innovation institutions and established a consensus on how to leverage regional resources, in the region to implement the strategy. We also have reached awareness of the importance of the strengthening research capacity and generating high-quality evidence to address public health priorities. We convened 15 experts from 15 member states and reached another consensus on renewing our commitments to strengthen clinical research capacity and collaboration in the region. Supporting countries to harness the power of the data and digital technology has been another priority. WHO supported Mongolia, Solomon Islands, Vanuatu, and Tonga to improve the availability of the timely and high-quality data. But just having good data is not enough. The data should be in good use. We have been working with Papua New Guinea and China to enable the strategic use of data by implementing the WHO Data Management Competency Framework. In addition, we have recently released the reports, Health Statistics in the Western Pacific Region 2023, Monitoring Health for the SDG, which provide us with regions' progress towards health-related SDGs targets and help identify critical gaps. Excellencies and then distinguished guests, progress towards the 2030 health-related SDG target is off track, globally as well as in our region. To keep our work on track, we convened the Technical Advisory Group on Universal Health Coverage and have identified 4 priority areas. Those are stronger focus on country impact, transforming primary health care, investing in a future-ready health workforce, and expanding digital health initiatives. This week, in line with these recommendations, we will present the Regional Action Framework on Digital Health for your consideration and endorsements. We also try to support you to imagine and prepare for the future of health. On this, we have just launched an exciting Museum of the Health Future exhibition under the big tent on the lawn you have just visited. Please enjoy the exhibition and share your future thinking together. Thank you.
Please welcome Dr. Hiramasa Okayasu. He is the Director of the Division of Healthy Environments and Populations, which works to address root causes of ill health by supporting member states to foster and build environments that enable and promote health.
Thank you very much. In the Western Pacific region, the majority of the disease burden have shifted to NCD, which accounted for 87% of all the disease burden deaths in the region in 2019. Countries across the region vary widely in terms of their success in reducing premature mortality from NCD. In fact, only a few countries in the regions are currently on track to achieve the 2030 SDG target of reducing premature deaths from the NCD. This has been compounded further by population aging experienced by all countries in the region, which increases the incidence and complexity of NCD. In line with the Regional Action Framework, we have adopted a comprehensive whole-of-government approach to NCD prevention, enhancing multi-sectoral collaboration, and then coordination addressing NCD risk factors. WHO has supported multi-sectoral collaboration in alcohol control, bringing together government sectors such as health, finance, transportation, education, and industry and commerce. This has strengthened capacity for evidence-based alcohol-related interventions in 5 countries with high or increasing alcohol consumption, including Cambodia, Laos PDR, Mongolia, the Philippines, and then Vietnam. Tobacco continues to be the major risk factor for NCD. WHO has been supporting countries to build a robust evidence-based for tobacco control measures. Notable progress in adopting major tobacco control policies have been achieved in Malaysia, the Laos PDR, and then Cook Island. Fostering support system beyond healthcare is also key to health promotion across the life course. For example, we supported the health promoting score across the region and supported cities' efforts to improve the health of their residents and reduce health inequities by covering countries to share best practices among healthy cities in the region. WHO has been supporting the implementation of the regional action framework on healthy aging, including social prescription that connect people to non-clinical services and community-based integrated health system. However, health inequity persists across the region, influenced by the social determinants of health. There is still a gap of 21.7 years between countries with the highest and the lowest life expectancies. Unfortunately, this has not been changed over the last 20 years. One of the key challenges in addressing this is the lack of health equity data. WHO conducted workshops with Cambodia, the Lao PDR, Malaysia, Mongolia, and the Philippines and Vietnam, using WHO-developed tools and an instrument to improve the ability of countries to measure, monitor, and set targets to combat health inequities. Climate change is an existential threat in the Western Pacific region, where rising sea levels are submerging islands. To ensure communities and health systems are ready, WHO has been developing guidelines and putting into effect climate-resilient interventions and climate-informed early warning system with countries. We will continue to foster cross-sectoral collaboration and promote evidence-based policy to tackle climate change and environment and related health threats. WHO remains committed to work with our member states to address NCD risk factors in the context of population aging, bridging gap in health, and the impact of climate change and the environment on health, and ultimately promoting healthier families, communities, and societies in our region. Thank you very much.
We now turn to Mr. Luis Benal-Solis. He is the Director of the Division of Health Systems and Services, which focuses on health system strengthening in the pursuit of affordable and equitable access to healthcare for all.
Ladies and gentlemen, our priority in the time period has been to transform primary healthcare in the region, which is the keystone to achieve universal health coverage. The region faces many challenges, such as fragmented health systems, health workforce shortages, and inadequate public financing. And they are not yet responsive to the massive social, economic, and demographic transitions. These challenges require revisiting how we work. We have adopted a three-pronged approach to address these challenges. First, is building foundational frameworks for health systems, providing conceptual clarity and supporting enabling functions such as laws and regulations. WHO work with the Ministry of Health in Cook Islands, Nauru, and Vanuatu to reform national legislation for public health. Through a regional effort co-led by the government of Japan and WHO, a paper to reiterate the urgency of addressing antimicrobial resistance was developed and presented at a ministerial meeting in Geneva during this year's World Health Assembly. 30 member states in Asia and the Pacific joined the collective advocacy effort that took the message to the United Nations General Assembly. The second approach focuses on intelligence generation, especially the production of evidence for policymaking. In Papua New Guinea, WHO supported the development of a stronger evidence base for policy planning and implementation to expand the health workforce. At the regional level, the report on monitoring financial protections in the Western Pacific helped illustrate trends and drivers of the region's worsening financial hardship issue. Finally, we aim at transforming primary healthcare and the systems to improve their performance. To accelerate access to medicines and vaccines, WHO support updates of the essential medicines list in Cambodia and Fiji, and in Laos, PDR, Malaysia, the Philippines, and Vietnam to participate in the WHO benchmarking process to strengthening national regulatory systems for medicines. Despite high coverage rates for antenatal care and birth and skill attendance in the region, maternal mortality reductions rate has slowed. An unacceptable 44 mothers per 100,000 die while giving birth in the region. Since 2019, WHO has supported 9 priority countries: Cambodia, China, Laos PDR, Mongolia, Papua New Guinea, the Philippines, Solomon, Vanuatu, and Vietnam, to provide hands-on facility-based quality improvements for maternal and neonatal care. So far, we have reached 6,500 facilities. And with your continued collaboration and support, WHO will build on recent progress and achievements to continue strengthening and transforming primary health care and health systems towards universal health coverage. Thank you very much.
Next, we welcome the Director for Division of Pacific Technical Support and WHO Representative for the South Pacific, Dr. Mark Jacobs. The division is responsible for supporting 21 Pacific Island countries and areas in the region, guided by the strategic directions set by the Pacific Health Ministers, the WHO Multi-Country Cooperation Strategy, and the Regional Director.
Pacific Island countries and areas face a triple disease burden: the epidemic of non-communicable diseases, outbreak-prone and emerging infectious diseases, as well as the devastating impacts of climate change. Close collaboration and coordination within the Pacific to address these public health issues is crucial. Alongside the Pacific community, WHO supported the 15th Pacific Health Ministers meeting, which renewed commitment towards strengthening multi-sectoral cooperation to address the drivers of obesity and the shortage of health workers. In fact, the Pacific's health workforce has suffered as health professionals have been migrating to other countries for several decades, along with leaving the workforce for other reasons. More recently, this has been exacerbated by COVID. WHO worked with ministries of health to help them strengthen health workforce planning and development, including on using data to understand challenges and inform decision-making. Another area of strong support is to combat non-communicable diseases, a key challenge that requires multi-sectoral solutions. Tobacco use is a major risk factor for NCDs and has been a key focus of our work. With WHO support, countries have taken various policy-level measures for tobacco control, such as the amendments to the Tobacco Products Control Act in the Cook Islands, which banned e-cigarettes. Whether by rising sea levels, prolonged droughts, increased risk of waterborne diseases, or increasing frequency of more extreme weather events, climate change is posing immediate threats to the health of communities in the Pacific. Therefore, WHO dedicated efforts in strengthening emergency response capacity and building resilience in both health systems and communities. 13 countries now have emergency medical teams, which can provide urgent medical care during emergencies. 7 of these teams have also been supported to build capacity for emergency deployments. Another major focus of our work is in building more climate resilient and environmentally sustainable health facilities. We've been working with several countries to use tools to assess the vulnerability of facilities and implement interventions to mitigate climate-related risks. Going forward, WHO will continue to work collaboratively with Pacific countries and partners to support health leaders, health systems and communities in their fight against the NCD epidemic, as well as the climate risks that threaten the health, well-being and physical survival of Pacific Islands. Thank you.
Please welcome back Regional Director, Dr. Saia Piukala, who will now share with you the 5-year vision for the Western Pacific region. Dr. Piukala.
While the Secretariat is fixing this technical problem, can we all put our hands together and thank all the directors of program and the division for and it is through our directors of all the programs and the division that they provide the support that is needed by our member states. As Madam Chair said earlier, I'm not alone. You are there to help me fix this technical issue and this Honourable Ministers, distinguished delegates. As we heard from the presentation of the technical directors, it has been a very busy but a very productive year. I am grateful for the spirit of collaboration that you, our member states, exemplify. It is my hope that the wealth of knowledge from this region can benefit other regions globally. We are already working on ways to increase our contributions to global health, and we are leveraging more opportunities with WHO collaborating centers and looking for ways to maximize the impact of our geographically dispersed offices. We also aim to showcase our work through the Director General's Award for Global Health. Rest assured, we will continue to find ways to champion our work in this region. Over the past 9 months, you have warmly welcomed me into your communities. And I tell you, I have been listening intently. And to ensure we got our vision right, we first assembled an integrated transition team made up of senior advisors from our member states, including representatives from China, Fiji, New Zealand, the Republic of Korea, the Philippines, Singapore, and Tonga, as well as Mr. Claire Excel and Mr. Son Lane of Australia, and Dr. Suzuki Yasuhiro of Japan, who are actually here with us today. Can we all put our hands together and thank the transition team for the good work that they do? The integrated transition team, in collaboration with WHO staff, systematically organize our ideas based on feedback from decision makers, health workers, and our communities. Successive drafts of the vision were then presented to you, our member states, through 3 different consultations with additional input from our expert collaboration centers across our region. What you see in front of you is the outcome of this enriching process. The document presented to this regional committee captures a shared vision. As such, it is a work in progress that we must be ready to revisit over the next 5 years so that we can address emerging issues and act on new ideas or opportunities in a timely manner. The vision emphasizes the critical role of families, communities, and the whole of society in achieving health for all. The vision document is entitled Weaving Health for Families, Communities, and Societies in the Western Pacific Region 2025-2029. In my village, we often say, you cannot get to where you want to go without acknowledging where you have come from. And before I share with you the details of this vision, please allow me to show you where I come from. Can we put our hands together and thank our technical team, even though they face difficulty, but they are not alone. They are with us. Yes. This is about diversity. You know, it's coming.
But upon reflecting where I came from and stand among the giant of public health globally, is a blessing.
Dr. Saia Piukala is the World Health Organization's first Pacific Islander Regional Director.
I never thought that it will happen. If a barefoot child with no electricity and transport can reach being the regional director, anybody can do it. I'm from Tonga, a very small Pacific Island country. And there's a saying here in Tonga is Si'ikaiha, basically meaning small but significant. My father, he was a farmer, told us that education will give you a better future. Back then, we didn't have electricity. We have to do our study on a kerosene lamp. I did all my training here, primary school and secondary school, and I got a scholarship to do medicine. So I left the village just to go straight to university.
It is Dr. Saia's lifespan in community and his decades of work on the front lines of health and his Tonga's Minister for Health that has informed his vision for WHO's work with member states in the Western Pacific region.
Every regional director comes to the office. They will have a vision. And I remember, growing up in the village, a source of income for most families is weaving. Weaving mats, weaving fan, men and women. They go and cut the bandanas. Some will bring long, short strands, thick, thin, different colors. But when would they come to the community hall, they know what is best to weave a mat. So the long one makes us to the short one, thick one made up for the thin one. But they see what is best to use, that will be beautiful and a source of pride. So I use the weaving metaphor as a symbol to visualize the collective action of everyone to promote, provide, and protect the health of the community.
In the region's Med of Health, the horizontal strands represent WHO support, ensuring countries' offices are equipped with skills for scaling up and innovation, that the regional office provides nimble support, and that there is effective communication for public health. The vertical strands represent actions for member states and other stakeholders working with WHO to achieve transformative primary health care for universal health coverage, climate-resilient health systems, resilient communities, societies, and health systems for health security, healthier people throughout the life course, and technology and innovation for future health equity.
We cannot do this alone. WHO cannot do this alone. We need communities, we need development partners, we need people. Everyone will have a contribution. big or small, but they will contribute to weaving a map of health for the region.
Through collective action, we can ensure that everyone in the Western Pacific region attains the highest possible level of health. Let's all come to that mat together.
Honourable Ministers, ladies and gentlemen, the act of coming together to weave a mat is known or is called Taulalanga. It is a communal activity never done in isolation. And throughout Asia and the Pacific, families and communities weave as part of their tradition. But mats in particular hold a significant place for cultures of this region. Many of our people are born on mats. Our children play on mats. Our youngsters study on mats. Elders talanoa and discuss issues on mats. We tell our stories while weaving mats and are wrapped in mats when they pass on. Indeed, they are the foundation upon which we celebrate beginnings, nurture growth, and honor endings, just like health. Mats form a crucial part of the foundation for every stage of our journey, from womb to tomb. Therefore, weaving a mat symbolizes the importance of a collective action to improve health and save lives in the Western Pacific. Indeed, this vision is a collective undertaking. We are living in time of uncertainty, with changing planet, ongoing conflicts, a fragile global economy, challenges to food system and other supply chains, and the speed and the spread of misinformation, and to name a few. In this context, it is essential that we must come together. Health is a collective effort, and especially when we face such significant challenges. Member States' priorities are organized into work streams represented by the interwoven strands of bandanas that come together to weave a mat. And these work streams cut across silos and enable collaborative development of ideas and talent. The vertical strands represent action for you, our member states, and other stakeholders, as you have seen in my video. Let me reiterate the importance of these 5 vertical strands: transformative primary healthcare for universal health coverage, climate resilient health systems, health security, healthier people through the life course, technology, and innovation. The horizontal strands, on the other hand, represent the action of us, WHO and staff, so that we are able to better deliver to our member states their priorities. I have been asked, how will I deliver this vision? It's not an easy question to answer. But to ensure that we are able to make this vision a reality, we have developed a strategy that centers on 2 things. First, we will accelerate our progress in areas where we already excel, but focusing on high priority aspects of our member state national health plans. And by doing so, we can make a significant impact and drive meaningful change. We have 23 acceleration points under the vertical strands of country action. Second, we have identified 13 different delivery for impact that we'll use to measure progress over the 5 years. Subsequent sessions of the regional committee will showcase work in countries that contribute to these acceleration points and targets. We will also strengthen and expand our learning and development programs to benefit more member states, including fellowship and the introduction of more innovative collaboration opportunities. Delivering on this vision will require careful planning, effective leadership, and ongoing commitment from all of us here in this conference hall and beyond. I look forward to future sessions of the Regional Committee where we can celebrate each other's hard work and success and continue to learn from one another to make this vision a reality. Honourable Ministers, distinguished delegates, I invite you all to join us in Taulalanga. Often the new vision gets called the new regional director's vision, but in reality, you are all co-authors of this document in your hands. This is not just my vision. This is our collective vision. Because at the center of everything we do are our families, our communities, including our schools, our elders, our frontline health workers, and broader societies, including all of us who are here today. I am grateful for all those in our families and communities who have been working to weave this mat of health so far. So allow me to invite you to lend your hand as we prepare the various strengths you will bring, regardless of their imperfection. But together, we can weave a mat that is beautiful, strong, and useful for all aspects of our lives. Like this mat that they are bringing in front of you. I brought these mats with me as a gesture of gratitude, humility, and commitment on my first day as regional director. Papatape kanai lalang. And this Tongan proverbs means that while our efforts may not be always produce a perfect result, like a mat woven with some coarse strands and spots, but it was woven. It is still strong, and it is still beautiful, and still useful. This vision is an ambitious endeavor, but I am very optimistic as I look around this room. My WHO colleagues here at WHO, the healthcare workers out there in the field, the advocates in our communities, our people, and our elders, and all of you representing your member states and partners who are here in this room today. Let us envision a future that is a testament to the strength of our beautiful diversity and teamwork in our region. You have seen my video, and as I recall being a barefoot child, running around the beaches of my small island, never did I imagine becoming Tonga's Minister of Health, and let alone your regional director, standing side by side with all the global giants in public health. And this was possible because along the way, there were those before me who opened doors and mentored and coached me. They gave me the confidence to do more. They gave me the confidence to do better. and they gave me the confidence to achieve the unimaginable. And let us pay our tribute to those who came before us. And let us care for those who will come after us. There are hundreds of millions of children now and in generations to come across our region. It is our responsibility to ensure that they enjoy the highest attainable standard of health and well-being. We just cannot fail them. Ministers, representatives from member states, let us all work together in building a world where no barefoot children looking out at the rising sea need to worry about their health or the health of their family and their community. Please, let us come together to weave a safer and a healthier future that we can all be proud of. And I thank you.
Distinguished representatives, once again, you will all agree with me to give another round of applause to our Regional Director, Dr. Saia. For that very inspiring and heartwarming presentation. And also to all the directors of programs. Also for reminding us not to forget who we are or where we come from and why we are all here today and this week. Thank you very much. As you all heard during the regional director's address, Vietnam is to receive recognition for its elimination of trachoma. Congratulations to Vietnam. May I call on the Chief Delegate, Professor Hang Thi Lin Nguyen, our Vice Minister of Health, to join Dr. Lee Island, Assistant Director General of Universal Health Coverage, Healthier Populations, and Dr. Piukala at the front for a brief presentation. Thank you very much, Honourable Ministers. Now we will go. It's time to open the floor and for any comments on agenda item 7. Please indicate your wish to speak by pushing on the button on your microphone. Thank you. Okay, now I see Philippines. You may take the floor. Thank you.
Thank you, Madam Chair. Honourable Regional Director, Dr. Saia Piukala, esteemed representatives from our fellow Western Pacific member states and from the international organizations, a pleasant morning to all of you. Thank you very much, RD, for reminding me that as a little boy, I also slept on mats like that. We called it banig. We played in it, we slept in it, and we ate on those banigs. Oh, sorry. It is my honor, bearing my country's call for inclusivity, we welcome you all to the Philippines for the 75th Regional Committee meeting. We call for inclusivity, diversity. The Philippine Islands extends its commitment to the region's collective action in weaving health for our families, communities, societies through the Philippines National Health Sector 8-point action agenda. My country draws strength from the diversity of our culture, our distinct islands of peoples, yet we are interwoven by a singular Filipino identity, one that is anchored on our resilience, positive outlook, and bayanihan or community spirit. In the face of health challenges, these valuable traits are what motivate us to face our future with determination and hope. The Philippines resolves to lead in transforming the health sector towards universal health coverage through transformative primary health care, modernization towards health equity, and improving access to health care at all levels. In particular, a top diplomatic priority of the Philippines is the sufficiency of the health workforce for the efficiency of all health systems. Amid high rates of high-wealth workforce migration and critical shortages in health workers globally, the Philippines is committed to lead and global and regional actions towards advancing an equitable and sustainable health workforce. Further, the country with the highest climate risk index, we recognize the urgent need to enhance climate resilience of our health facilities as we face increasing climate-related threats. It is essential that our health infrastructures are not only sustainable, but also capable of withstanding and swiftly recovering from environmental shocks. We underscore the role of the member states in taking hold yet decisive policy actions to ensure greater investments in health. Our investments and contribution to WHO will facilitate the achievement of the Western Pacific's regional vision and the 14th General Program of Work. We seek to demonstrate that emerging economies can substantially contribute to sustaining regional health efforts through continuous support for the Contingency Fund for Emergencies and contributions for WHO's work for Pacific Island countries, human resources, climate change, and health security. We believe in multilateralism through our dedication to and ownership of collective actions for global initiatives such as our leadership in global TB initiatives and patient safety efforts, Health for Life Fund and the Pandemic Fund, the WHO Investment Round, and the Intergovernmental Negotiating Body for the Pandemic Agreement. We take this opportunity to invite all of you to the 7th Global Patient Safety Meeting, which will be hosted by the Philippines on the 3rd and 4th of April in 2025. The Philippines looks forward to the WHO's country cooperation strategy for the Philippines. We sincerely appreciate that it now includes the Secretariat's support to strengthen our catalytic role in the global health arena. Finally, woven by the strands of our common interests and aspirations and adorned by the beauty of our diversities and in uniqueness, I sincerely believe that our collective future in the Western Pacific is one exquisite tapestry. Mabuhay. Maraming salamat po.
Thank you very much, Representative from Philippines. Now I call on our representative from Cambodia.
Madam Chairperson, Mr. Regional Director, dear colleague, I'm happy to come here to exchange with our colleague from the region. Indeed, only common reflection can help us strengthen our response to the many challenges we are facing. Together with all the other member states, the Cambodian health system is confronting global challenges. With those who are in the intermediate phase of their development, it shares the challenges of the epidemiological transition marked by the coexistence of communicable diseases and the increase in non-communicable diseases. But its ability to respond is still affected by certain weakness characteristics of less advanced system. It suffers in particular from a significant lack of health professionals as well as a qualitative deficit of specialists. On the other hand, for historical reasons of reconstruction, our health system had to give priority to the acute diseases component. We therefore have a very low proportion of resources devoted to prevention, which is a handicap in the fight against chronic diseases and their social determinant. We therefore need to help the most of advanced member states, and we also expect from our discussion the opportunity to benefit from experiences on operational tools to improve the efficiency of our intervention. Indeed, we have defined sectorial strategy, but we often encounter difficulty in their implementation in the field due to the lack of qualified human resource. We hope the multiplication of opportunity for the meeting between technical experts from the region beyond institutional meeting. Cambodia will be happy to welcome some of them, and it will also be an opportunity for us to exchange on the success we have recorded. It is important for the pride and motivation for the staff and the confidence of the population. Faced with global challenges, we also expect from our discussion the opportunity to make the voice of the less developed country heard higher collectively and in solidarity. As we said before, during the World Health Assembly in Geneva last May, we must change the global situation with a view to improve access to vaccine in epidemic situation, and more broadly to essential health drugs and products, as well as to the increasingly decisive therapeutic innovation, for example, in the fight against cancer. Without this fundamental, a number of our strategies will be doomed to failure. It is therefore our responsibility as leaders toward our fellow citizens, which is committed. Together, if we speak one voice, we can change the situation for the benefit of all in accordance with our value of solidarity and inclusion. I thank you.
Thank you very much, Cambodia. Now I call on Cook Islands.
Madam Chair, Honourable Ministers, Regional Director, distinguished delegates, ladies and gentlemen, Kia ora. The Cook Islands government, once again, thank you, Regional Director and your team, for your brief visit to Rarotonga in time for the annual National Health Conference 2024, and to the beautiful island of Waitaki to launch the new oxygen plant. Your presence in the Cook Islands also included the launch of key documents, such as the Cook Islands Pandemic Preparedness Plan 2024, the Food-Based Dietary Guideline 2024, and the Physical Fitness Guideline 2024. I acknowledge the significant technical support from WHO to the development of these key documents and to some degree FAO. Your leadership and the support of the WHO staff under your leadership is well noted and testament to the success and achievements that you have reported in the last 12 months while in office as Regional Director. The Cook Islands also acknowledge the significant support from the WHO Regional Office in advancing key initiatives to improve the health and well-being of our people through the Healthy and Smoke-Free Island initiatives. However, more remains to be done, and under your leadership in WIPRO, we are confident with the new vision of weaving health for all, clearly embraces our collective uniqueness as the Western Pacific region, as we weave ourselves together as health leaders and officials, that together, not only that we will be stronger when we weave ourselves together, but achieve more for our families and the communities that we serve. Congratulations again, and know that you are not alone. We are with you. Like how we carried you on the pata, on our shoulders of our warriors, we will do the same in advancing this new vision. Your Honor, Madam Chair, I thank you.
Thank you very much, our representative from the Cook Islands. Now, I will call on Republic of Korea.
Thank you, Madam Chair. Regional Director Dr. Saia Piukala, delegations, ladies and gentlemen. The Republic of Korea appreciates various achievements of the WIPRO Secretariat that has improved health security in the Western Pacific region, contributed to achieving universal health coverage, managed chronic illnesses and aging, and addressed climate and environmental changes. Over the last year, in particular, the Republic of Korea notes the achievement mentioned in the report that include establishing a health data platform for the Western Pacific region, strengthening vaccination and cooperation for promoting health in the Pacific Island countries and areas, preparing for health emergencies, and improving SDG indicators regarding social determinants of health. We thank Regional Director for your leadership in resolving current issues in the Western Pacific region, and we also thank the staff members at the Secretariat for your hard work. Now, we are facing the challenges of expediting the achievement of health-related SDGs by 2030. With the successful start of implementing GPW14, approved at the last World Health Assembly in May, building on the achievements in the region. For this, we can say reforming the health digital technologies for achieving UHC are topics that should be addressed with significance. We hope this committee, with the various agenda items, serves as an opportunity for the members in the West Pacific region to bring together their insights and come up with specific solutions. The Republic of Korea will participate actively. The Republic of Korea will also keep the lessons learned from the COVID-19 pandemic. We will continue to make effort for maintaining the momentum in strengthening global health security by participating in the ongoing negotiation for the pandemic treaty, while implementing the revised international health resolutions adopted at the Assembly. Also, the Republic of Korea hosts the third World Bio Summit, which will be held in Seoul, Korea next month. Under the theme of future investments for a safe and healthy decade to come, WHO has agreed to co-host the summit with the Korean government, as it did for the first and second summits. We express our deepest gratitude to WHO for your participation and support, and we kindly ask all our members for your interest in the World Bio Summit in Korea. The Republic of Korea will continue to address health-related tasks present in the Western Pacific region and cooperate in ensuring health equity, promoting health, and responding to healthcare crisis. We kindly ask you to join us. Thank you.
Thank you very much. Now I will call on representative from Fiji. And before Fiji takes the floor, ladies and gentlemen, we've just gone past lunchtime. However, we are ahead of time. So with your indulgence, we'll continue on for a few more interventions. Then we will call for a break, lunch break. Thank you. Call on Fiji.
Thank you, Madam Chair, honourable panel members of the forum, Nimbuluvinak. Allow me to begin by first congratulating you, Minister of Health of the Cook Islands, as the first lady honourable member to be appointed chair of the regional committee meeting. I also wish to congratulate the Minister of Health of Vietnam, also a lady honourable member, as the deputy chair of the 75th regional committee meeting in 2024. I also wish to congratulate Dr. Saia Piukala, former Health Minister of Tonga, on your appointment as Regional Director and hosting your first Regional Committee meeting as the RD. Fiji wishes you the very best on your tenure as our Regional Director for the Western Pacific region. Fiji acknowledges the RD report and the work that the WHO is undertaking at the regional and national levels in support of the work that our national ministries are doing to improve the health services and health status of our population. The support towards our transforming primary health care in Fiji and strengthening school health provides the best approach to achieve universal health coverage for our people and to overcome the NCD crisis now and into the future. The support on climate change and health, AMR and One Health, and regulation of medicines and medicinal products ensures that the health and well-being of the future of our population in Fiji are protected and enhanced for the years to come. On the vision for the next 4 years, Fiji fully endorses RD's visions of viewing health for the next 4 years, bringing together our different strengths, talents and opportunities for a stronger and healthier population in the Western Pacific region. We know that when a strand stands on its own, it has limited strength to withstand strain and external pressure. When it is woven with others, then it gains strength and durability and can withstand forces much greater than what it could overcome on its own. Similarly, weaving the strength of our health ministries, government partners, communities, civil societies, and our traditions and culture and our belief systems will not make us weaker, but build our health system stronger and more resilient, and our health status improved for our next generations. Fiji looks forward to the support of WHO and our partners in addressing the health issues in Fiji and our member states in the region. I thank you.
Thank you very much, Representative from Fiji. I now call on our representative from New Zealand.
I greet the sky, I greet the earth, I greet everyone here this afternoon. Good afternoon. Chair, Minister, distinguished delegates, I'm delighted to be here for the 75th Regional Committee meeting. I particularly wish to acknowledge the Regional Director and congratulate him and his team for the very busy and successful start to his new role. We are a diverse region, experiencing the full breadth of health challenges against a backdrop of natural hazards and the impacts of climate change. This complexity requires us to focus on what is most important for the health and well-being of our populations, and it requires us to vigorously track our progress to be sure that we're making a difference. Chair, as the Minister of Health in New Zealand, I have introduced an ambitious new direction for health. The mission statement is timely access to quality health care that improves life expectancy and quality of life. I firmly believe that clear targets are important for improving the performance of the health system. Mr. Chair, I know this is important to you also. To that effect, our 5 top-line health targets are faster cancer treatment, increased childhood immunisation, shorter stays in hospital emergency departments, and shorter wait times for assessment and treatment. To improve life expectancy and quality of life, I have introduced a 5+5+5 framework that aligns with the Sustainable Development Goals and WHO's NDC guidance. In addition to the 5 top-line health targets, this includes 5 modifiable behaviours: smoking, alcohol, diet, exercise, and social cohesion, and 5 pathologies: cardiovascular, respiratory, cancer, diabetes, and mental health. Timely access to quality health care also requires us to prioritise the workforce and infrastructure as enablers. For example, we are expanding the vaccinator workforce to help achieve our immunisation targets. In December, I announced an initiative with Māori, our Indigenous health providers. This will reach our remote and vulnerable populations and deliver vaccine efficiency. These Indigenous providers go and do what mainstream cannot and will not. Early data shows that this approach has delivered more than 3 times the initial vaccine target within just the first 6 months. As a region, we share many of the same challenges. I wish to thank the Regional Director for the time and effort to consult on weaving health for families, communities and societies in the Western Pacific region. This includes the delivery for impact targets for the next 5 years, which we will follow closely. We have a traditional Māori saying in New Zealand, mā whero, mā pango ka oti ai te mahi. The new vision and its woven mat analogy reminds me of this. Essentially, this proverb refers to the red and black strands that are woven together to create panels inside our traditional meeting houses. This symbolises collaboration between leaders and communities who come together to achieve results collectively. I believe that this important and central theme of the vision resonates well with our shared purpose as a regional committee. I very much look forward to the discussions over the coming days. Dr. Saia, you have New Zealand's full support for your vision, for the region, and I wish you well. I wish us all well. Ngā mihi kia koutou.
Thank you very much, Honourable Minister from New Zealand. Ladies and gentlemen, I am sorry to say we will be suspending at this time and have a break. We will all go for lunch and resume back here at 2 p.m. Before we do so, may I call upon Director of Administration and Finance, Dr. Tamas Landis, for the administrative announcements. Thank you.
Thank you very much, Madam Chair, honourable ministers, distinguished delegates. I would like to share with you some announcements about the planned proceedings for the rest of the day, with your permission. The Daily Journal is now available on the WHO Western Pacific Region website and through the WHO Event mobile app. You can download the app by clicking on the QR code that is displayed on the walls and on these little cards that we placed on your tables. The journal is also available upon request at the inquiry desk in the foyer of the conference hall. Any corrections should be submitted in writing to the inquiry desk, please. Starting today, daily lunch for all participants will be served at the cafeteria located at the ground floor, just to the right of the entrance as you exit. And we
sorry. Yeah, we have taken into consideration, sorry, your dietary requirements, and this was important. That's why I wanted to make sure I say it. We include the vegan, vegetarian, and halal selections. As you requested, the tax placed on the food station will guide your way. The afternoon session, as Madam Chair mentioned, we reconvene at 1400 in this plenary. Now, a few more general announcements, if you allow me. For security reasons, we ask you kindly to wear your badges at all times during the sessions and also at the receptions. Those who have not received their badges may proceed to the inquiry desk. As part of Vipro's ongoing green initiative, we are reducing documents being printed, as you can see, and RC documents are available both on the website of the region and the events mobile app that I mentioned. But again, if you need hard copies, we are pleased to provide it to you. Just contact the inquiry desk. Limited number of hard copies of draft resolutions and conference papers will be available also at the inquiry desk. Of course, all documents will be available online. Vipro publications on display at the publication stand outside this conference hall can be accessed again through the associated QR code online. And this will link you to the WHO's online library called IRIS. Hard copies can be ordered upon request through the publication unit. There's an internet cafe as well that we set up for you, located at the lower lounge of the conference hall, just to the right of this door here, and will be available throughout the conference. Details are available at the inquiry desk for wireless internet connection if you need it, but also on these little cards you have the codes. Transportation is available to and from the meetings, and the schedule will be posted every day in the lobby of your hotels. Please leave the wireless receivers and these headsets in the conference hall during every coffee break and at the conclusion of each session. List of representatives has been posted on the regional committee portal. The list per delegation will be sent by email to your respective focal points at the end of the session today. Kindly verify the information. It is very important for your delegation to ensure that they are accurate on the official list, and submit your updates and corrections to the inquiry desk by return email by the end of the session tomorrow on Tuesday. We would like to remind you as well that in line with the general information booklet provided to all participants before the meeting, we assume your consent to being depicted in the photos and videos taken during the RCM, and agree that WHO may reproduce and publicly disseminate any of the footage on its website or elsewhere. Footage is being taken throughout the event and will be posted online in real time. You can access these images via our multimedia library available on the RCM app or on our website. Further, we encourage you active engagement on social media. To support this, we have developed the RCM 75 social media kit, which is available on both the app and our website. QR codes linking photo libraries and the social media kit are displayed on screens at the venue. And finally, I would like to inform you that WHO introduced a policy prohibiting alcohol consumption at events organized or co-organized by regional or country offices in the Western Pacific region. Consumption of alcohol in our offices or exchange of alcohol or gifts on any occasion is not permitted. And lastly, I would like to remind you that smoking, of the smoking policy on our WHO premises. Thank you, Madam Chairperson.
Thank you very much, Dr. Landis. Now we can all go for break. Thank you very much. We'll see you all back in conference room at 2 p.m.